gonna.
Hi.
Hi, so this is recording already. It's gonna have to, I don't want it to though.
Welcome to the Jewish Orthodox Women's Medical Association, or JOMA podcast. I'm your host, Elisa Minkin. I'm a general pediatrician and proud JOMA member, and I'm really honored and really excited to be here tonight with Dr. Adena Blickstein. Hi.
Hi.
I'm glad we're finally doing this. We had a lot of conversations about this. Dr. Blickstein, MD, MPH, is a practicing child and adolescent psychiatrist in New York with a passion for mental health, public health, and children's welfare. She is a graduate of Technion Medical School in Israel and Columbia University's Mailman School of Public Health. Completed her medical internship at Westchester Medical Center, psychiatry residency at Metropolitan Hospital, and specialty training in child and adolescent psychiatry at Westchester Medical Center. That is super impressive. With her skills, passion, and experience, she is focused on supporting, leading, and building progressive mindsets that yield systemic change in our currently fragmented mental health and educational system in order to optimize access and quality of care for children and families. Beyond her clinical skills, she possesses strong skills in communications, child advocacy, and community activism. She is a catalyst for empowerment for individuals and communities and uses her creativity and skills in her work as a physician and mental health professional. So that is just unbelievable. And this is only really part of your bio. I truncated all the interesting personal stuff. So thank you so much for joining me tonight. And I want to start, I'm calling this holistic psychiatry. I know you've used different terms, but I think basically what you do falls into the basic general domain of holistic psychiatry. I mentioned it to somebody today and they had never heard of it. So I don't know how many of our listeners know. Could you start just by telling us what is holistic psychiatry?
Sure. So psychiatry has become a field that's more or less pharmaceutical oriented. And a lot of people now from general practices or even therapists refer to psychiatrists generally for medication management. Mm. But there's a misconception. I think where our field tends to be pigeonholed into just med management. And that's not true, especially when it comes to child adolescent psychiatry. A lot of what we do is we liaison to through systems of care, through mental health systems, through educational systems. We work with case managers. We are like the primary mental health practitioner for the child. And I find myself collaborating with teachers, with parents, with providers, medical providers, therapeutic providers like social workers or psychologists, and teachers as well. So by nature of the field, it is holistic. I just think that a lot of people have a misconception because a lot of the field has become so just narrowed. It has
right. I'm going to call out the elephant in the room, and that's reimbursement. Mm-hmm. Right.
I mean, I think that working through insurance companies definitely guides treatment from diagnosis to medication, and that's it. But I never ever pigeonholed people, and especially children, because children are largely affected by their infrastructure. And I have a lot of children coming to me with symptoms of anxiety and depression, largely related to their educational needs not being met in school.
Right.
Or they have an undiagnosed learning disability that wasn't covered, and there's a mismatch between their educational systems and their needs. And a huge part of why a kid would get depressed and anxious. And another part, of course, is the home environment. So I have a lot of children within litigious divorces and educational systems not being met. So then you have this explosive, aggressive child, and then mainstream psychiatry or traditional psychiatry, I don't want to label, but they would plop on this diagnosis of DMDD, which is dysregulated mood, prescribe an antipsychotic, and then but what's happening on the outside is parents are going through the divorce, child has dyslexia that was never found out. And of course, the child's going to act out in this environment. So, so I look at the work that I do where I see the child as a sponge. There are biochemical and environmental or genetics, so to speak, predispositions, but when there are 6 systems that are not attuning to the child's needs, the child will react. And their reactions, we need to understand that at them as reactions and not the core.
Right.
And I always have a very conservative approach to medication. I really want to have a really detailed sense of what's going on before I prescribe, if I feel that medications are necessary. And if I have a family and an educational system that is willing to work with what the child needs, many times medications aren't necessary, except in acute situations where intervention really needs to happen. If you have teachers that are open-minded, if you have administrators that are open-minded, if there's families are flexible for transferring a child, if parents, both parents, are willing to collaborate with each other and with the team, solutions are very easily found. The issue is when that doesn't happen.
Right. But I mean, when I talked about the elephant in the room, I mean that the way our current medical system, at least in the United States, works is mental health is not reimbursed the way physical health is.
Mm-hmm.
And so it's very hard to find a psychiatrist that takes insurance because the insurance will not reimburse them properly for their time.
Mm-hmm.
You know, somebody who's another specialist can do a procedure that takes 5 minutes and get hundreds of dollars. And a psychiatrist might get paid, what, $50, $45 an hour, you know, 10, whatever, like some, I don't know exactly what it is, but some tiny amount that is not worth the time of somebody with that professional background.
Mm-hmm.
So what you're talking about is time consuming.
Of course.
And that's the huge, huge elephant in the room, that children should have time, should have professionals that get paid to put time into helping them.
Mm-hmm. And that's why in my personal practice, I do not take insurance.
Right.
But I work on a sliding scale with every single family to make it affordable, because I find for me financially, it always evens out when I give people
Good for you.
a sliding scale option.
Mm-hmm.
The reason I don't take insurance is not because I don't want people to have a better rate, but because I want to have an authentic relationship with everybody I work with. And I don't want interference, energetic interference, insurance reimbursement interference, that I have to choose a certain diagnosis or prescribe a certain medication, because I think that really colors my assessment and it colors what I feel the child really needs. And if I don't feel like they have PTSD, for example, but I feel they're being abused, I don't want to have to finagle diagnoses because of a reimbursement issue.
Right.
And because it labels the child. And my goal is to be as authentic and honest as possible. And to get around the financial barrier, I always work on a sliding scale with families. So
that's amazing, because a lot of people do charge an enormous amount to do holistic, you know, psychiatry. And I want to, be clear about holistic. When you're using the word holistic, the way I used to be in a pediatric practice, where the head doctor called it holistic with a W, meaning he dealt with the whole family. He was a family medicine specialist. And I mean, whole members of the family. I meant just the whole infrastructure of the family and the child and school and all of these different factors. That's what you mean. A lot of people hear holistic and they mean alternative. I think that there are components that you do that are alternative medicine as well. So I want to just make that clear, that when we say holistic, there's different ways of interpreting it.
Right. So I call myself a lot of different things, and I don't really go by what mainstream terminology sees myself as. So as the best descriptor as I find myself as. So holistic in the sense is that I look at the whole, like W, like I resonate with that.
Right.
But when I refer to myself as using alternate modalities, I call myself an integrative psychiatrist, because the modalities that I use to intervene are not just medication management. I use energy healing, I use trauma-based therapies, and I use performative therapeutic behaviors or actions, as well as mantras and mindfulness.
So let's go through all of those so
Yeah.
our listeners can know exactly what you mean. Go through them one by one, please.
Sure. What did I say first?
Energy healing.
Energy healing. Okay, sure. So I have really delved into spirituality, and I practice meditation every single day right now, usually twice a day. And the energy healing that I use goes according to the chakra system, where we have energy systems in our body that are in different places of our body, and it corresponds to different parts of our body. So we have the root chakra, which is in the pelvic area. We have the sacral chakra, which is in the belly button, solar plexus, which is in under the rib cage. We have the heart chakra. We have the throat chakra in the throat area. We have the third eye, and we have the crown. There are more extensive chakras, but those are the basic chakras I work with.
I just want to interrupt you for just a minute. This is not a halacha podcast. This is a medical podcast.
Yeah.
But I know I did look up, energy healing. And I know, like, for example, Rav Asher Weiss says that this is a permissible, not, all alternative medicine. Some of them are controversial. But this one I don't believe is.
Yes. And it's not invasive whatsoever.
Right.
I don't
Just in case people are wondering, we're not here for halacha. Ask your local Orthodox rabbi. But I just wanted to throw that out in person. Oh, what chakra? That sounds like, it could be Avodah Zarah,
Yeah, there's a great movie called The Chakra Movie. It's spelled Chakra, and it explains these energy systems, and you can look them up online. And they're not really affiliated with any particular religion, from my understanding. It's that every human being has this system. It's a way to organize an energy structure in everybody's body. And so I have a modality that I use that I have become so sensitive because I do this work on myself, where I can do a energy scan on a person. I don't touch them, but I hover my hands over their body, about an inch away from their body. And I could feel which chakras are too closed, which ones are fragmented, which ones need brightness. And I draw the energy scan of the person as part of my diagnostic modality. It's part of my assessment, and I draw their energy system, and I say, okay, this is what the body is showing me where it's misaligned. And the reason I do that is because language is very limited, especially when it comes to trauma, and especially when it comes to healing. The body tells us much more about where we need to go than words can. Because before, when we were young, we only learned to talk when we were 2 or 2.5, 3. That's already 2 years later. The first language is energy. The first language has always been energy. And trauma is, a lot of times when children go through trauma, they actually repress it so much that they either don't have memories of it or they can't even verbalize it, but it sits in the body. So the energy scans I do is just another level and a deeper layer of helping a person navigate where they need to go in healing. I'll just give a brief example. I was working with a patient, and there were some digestive issues involved that corresponded to anxiety. And I did an energy scan on her and found that the solar plexus chakra was very constricted. The solar plexus chakra corresponds to confidence. And when a person's not confident, they have a constriction in the solar plexus. But what that does is it leads to reflux because the food doesn't go down. And it was true. And there were a lot of feelings of inadequacy and feelings of not being good enough there. That was from her symptoms. So we worked on a exercise where she focused on expanding that area of her body, and which was the solar plexus chakra. And over time, those thoughts change with the energy change with those exercises. So that's just one of the modalities that I use. In addition,
now I have to stop you.
Yeah.
I am a skeptical Western medicine kind of girl.
Okay.
This is not that. And by the way, I am representing JOMA, and I always feel like I have to give a disclaimer. I mean, we're not here for medical advice in general. Everything you hear is for informational purposes only, as it says somewhere. But I'm going to be a skeptic and wonder, do you have patients that come in and they say, I don't believe this, or they're just skeptical like I'm being right now?
Well, because I'm just traditionally trained, and I have an MD and I have a license, people don't come to me. They come to me for help.
Mhm.
They come to me because they're suffering and they want alleviation of their symptoms. And I don't necessarily say, this is what I'm going to do. I offer, would you be amenable to me just scanning your energy? It sometimes could help people. And if they say yes, yes, if no, no.
Right.
Even
So
if
sometimes you do it and sometimes you don't. In other words,
Yeah.
people may say, I just don't feel comfortable. I don't buy into that. And then you're
Absolutely.
fine. You don't need to.
Exactly. And I also don't really need to do an energy scan because usually I can feel a person's issues just by talking to them, because every person we all have this. We all have a sense of intuition. We all have a sense of if someone has really positive vibe, negative vibe, so-so vibe. We all have this. The mindfulness and meditation exercises that I do just get me really, really focused so I can pick that up really fast. And also being with patients and families has helped me kind of read people really easily.
Right. But you can tell me if I'm wrong, but I would also imagine that people vary on the spectrum of intuitiveness.
Absolutely.
And if you're a very intuitive person, that may be something you're good at to begin with.
Yes. And it's also something that can be honed, just like reading, just like computer skills. So intuition and insight fall hand in hand. I always say that the greater the insight of a person, the further they can go in their healing process and their mental health. It's all about insight.
For sure.
If they have more insight into what's happening and more self-awareness, or they have more basically intuition, then their healing progresses more quickly and they can find the resources they need because they're not necessarily blocked. They're aware of what's going on. They realize they need the help, and then they can move faster along the process. And my goal is that I help people gain that insight to become aware of what's happening. And the increases in insight really just expedite the healing and mental health. So
can you give an example of that? We could tell our story now, how when I tried to talk to the other day, I remember my road was blocked, my one road to get out from my house to work.
Right.
And I had to take a different route.
Right. Okay, perfect example. It's very concrete. So you have a road map, and the map shows you only a certain way to go, but the actual way to get there is blocked.
Right.
Now, in a person's psyche, we all have blocks. We all have blocks because as children, we absorb information from the environment that is already blocked. So let's say we had a teacher who didn't feel we were good enough in a certain subject. So they would say, or not even say, but feel, you're not good enough. Children learn by energy. They don't learn by didactics. So if a child went into a class and just never felt the teacher cared enough, they would internalize this feeling, I'm not good enough at math. That's a block. And so just like that road to get from point A to point B, let's say that later on this child applied to college and needed to do a math exam. So they would avoid or get panicked or try to go around all these ways to just try to get through this exam, when really the block is that I'm good enough, and they could just get there straight. So the insight would be to realize that this blocked belief happened in their 5th grade math class. And it's not them, it's not true, it's false.
So how do you get to that insight though? You're not a psychotherapist. You don't do psychotherapy, do you?
I integrate therapy with medication, with energy. So because I deal with so much trauma, again, everything is trauma. So parents have childhood trauma. Children have parental childhood trauma. Parents carry transgenerational trauma from their parents. So everything is trauma. And so what we are really, we're pure divine beings that can do anything. It's only our limiting beliefs that limit us in the world. And so every limiting belief stems from an experience of trauma. And we're sometimes not even conscious of it. And that's why we recreate it. A lot of times we recreate trauma in relationships. So if our mother was very overbearing and didn't let us have independence, we are likely to be attracted to a woman who is similar, unless we're aware that we've absorbed that type of mindset from our mother, and then we're changing it to be more authentic to who we are.
How do you get to those insights though? I mean, I'm still thinking you don't have multiple therapeutic insight type based sessions, that you do it differently.
When you understand energy modalities,
Mhm.
it's hard for me to describe so
To put it in
concretely,
words.
but there are energetic patterns that every human being has, and they repeat and repeat and repeat. And if you look at archetypes, or if you look at Jung, who describes archetypical structures,
Mhm.
everyone can be fit in a certain archetypical structure. And so within 5 minutes of talking to someone, I see that the pattern, because of their parents, the parents are fathers like this, mothers like, masculine and feminine archetypes have similar energetic structures, of course, with little modifications, but I see the patterns of the father, patterns of the mother, see what blocks or issues the parent is having. And then that archetype it usually just repeats itself in the child. And they're usually always spectrums, right? So there's the permissive versus the authoritarian parenting perspective. When you understand patterns, the way I like to describe it is architecture, right? You can build 20 buildings that are different, beautiful types of buildings, but the physics are the same. And to have a stable structure, you need the same components. It's the same with the human psyche. We have our positive and we have our shadows, and everybody has both.
Right, but how do you find this out?
Interviews.
Okay.
Yeah. I'm talking, right? Like I'm
Right.
assessing them. I'm feeling the energy. Every assessment I do is in the home. The first assessment I do is I go to the home. So I see
That's amazing.
I see the objects in the home. I see what food is in the home. I do something called a fridge evaluation, right? It tells me everything. What's the nutritional status of the family?
Oh, that could be embarrassing.
Of course, but that's the belly of the home.
It's true.
The fridge eval tells me what people are eating, how finished are the food, if there's spoiled food in the fridge. It tells me the organizational, nutritional, it tells me everything. I get a tour. The first thing I do is when I walk into the home, I get a tour, and I don't even almost have to talk to a patient, because seeing what a home is
Mhm.
just the energy manifest of the person. And so I see what paintings they have, I see what objects they have, I see the kids' rooms, I see where they're sleeping, where are the kids sleeping, where are the parents sleeping, are they separate beds, are they together, is it single mom, is it whose grandma's there, or not, so the physical structure of the home, the energy of the home, every space also has an energy, right? Is there a lot of negative energy? Is there a lot of tension in the home? When I walk in the home, do I feel like uncomfortable? So if I'm feeling weird and kind of uncomfortable, how is the kid feeling, right?
It's incredible though that you can sense this though.
But
my mind is blowing a little bit.
Everybody can and everybody does.
It's learnable is what you're saying.
Everybody can and everybody does. But when you walk into a home and you're not comfortable, you don't feel comfortable. It's a body, it's a visceral feeling. You might not say it, you might not verbalize it, but everywhere, when you go into a restaurant and there's a nice ambiance, you feel the good energy. If you go into a restaurant and there's a bad ambiance, you feel the bad energy. Everybody feels energy. It's just whether they actually attune to it or verbalize it or use it in their life. And we do that in dating too. We do that with people. We feel energy immediately. It's whether we listen to that feeling that determines where we decide to guide our life. So the way I get this information is the home visit, the interviews, mostly. Then the collateral information, the talking to the teachers. But usually once I enter a home, I'm usually I can get the picture. It's like a visual, right? You can talk and talk, but when you see a picture or a painting, you get an impression. So the home is that impression.
I'm guessing you don't do telehealth then.
I do both. So
how do you get the energy through telehealth?
No, but my home initial evaluations are in the home.
Always in the home. So somebody could not come to you by telehealth who doesn't live near you. They would have to be close enough for you to travel to them.
So there are certain exceptions where I don't go to the home, especially for myself, that I take safety precautions. There has to be If it's a male, there has to be somebody there physically present. It depends on if they live in a certain facility, like it depends on, if it's an area that I'm not comfortable with. So I give people a choice, but I always say that home visits will give me the most information.
It's the ideal.
It's the ideal, yes. And a lot of my patients, I do mixed, right? So I'll give them the home visit option as the assessment. Then I'll do follow-ups, virtual or in my office. And then I have a 5-week healing program where it's an intensive twice a week therapeutic intervention, 5 weeks, where I recommend that to everybody because when I push people on the right track with discipline and meditative exercises, then they're really on their own. They really can do it. They can do everything they need to do on their own. It's just about kind of focusing them. So I don't like people to be dependent on me. That's not what my goal is. And I don't want to create an attitude that they need me. I'm just a facilitator of their own healing. And I give them the tools and can guide them by assessing what's really the issue or the core issue, because a lot of people get confused about the core issue. And then the practices and or medication and or shifts in the environment to put them on that track.
Mm-hmm. And you do use medication just judiciously.
Yes. And it's always in collaboration with the family. Unless it's emergent, which I don't deal with emergencies because I'm doing outpatient. I'm not doing emergency rooms. I'm not doing inpatient. And if I feel if someone needs a higher level of care and they can't be managed, which I have had assessments where I said, you have a complex medical history and psychiatric history, you need an inpatient setting to manage this. Then medications are always frequently just a matter of choice, between the family and me.
But I'm pointing this out, even though we said it before, because I feel like there's been a false dichotomy between mainstream and alternative medicine. Mainstream medicine is just evidence-based standard Western medicine, and alternative is, other things. When it comes to psychiatry, they would be anti-medication. And I think it's a false dichotomy. I mean, here you're using both.
Yeah. I mean, I don't know how many integrative, holistic child adolescent psychiatrists there are who market themselves as such. But as a paradigm, the pure medication model never really resonated with me. And I guess every family has to make a choice about what kind of service they're going to seek for their child, because some people, if a child is on the spectrum with severe neurocognitive issues and dysregulating issues, they might need a practitioner who's very medically pharmacologically oriented, and they might not fare well with someone who's more integrated. Because there are cognitive limitations and maybe physical limitations. Every family makes a choice for what's best for their child.
Right. But even for a child who's cognitively limited, say on the autism spectrum, a lot of times with good behavioral intervention and the appropriate academic setting, they could be, on less or no medication.
100%. And I offer that. But I know that families have all the therapists they might need, and they might not need a psychiatrist who does those other things. And so every family within the spectrum of holistic and integrated, I know where I stand, as opposed to other practitioners where medication management is really the only thing that is needed for the family. And so, everyone chooses the practitioner that would meet their need for their family. And that's why I'm saying I don't put down really experienced pharmacologists that are amazing with the medications and the tweaking and the titrating, because there is need for that.
It's life-saving. And that's the concern for people who are going to alternative practitioners who don't have the capacity or who are against a medication. And I'm sure you've heard horror stories of children or adults who should have been on medication and were not because of an anti-medication belief.
Correct. Right. And I don't harbor that belief. And I never I'm not a pill pusher. I'm not a pill denier.
Right.
I always say
it works.
Pills and skills.
I love it.
When you have one, you can have less of the other. When you have one of the other, you can have less of the. It's a balance.
Right. And there's so many factors, in terms of the function of the family, for example. You may have a family, like you said, that's, having a lot of family stress. They're moving, divorcing, whatever. A lot of things are going on, and they just don't have the capacity to maybe work, say, more on the behaviors.
Right. And also, medications are not forever.
Right.
And I usually say, if someone breaks a leg, they need crutches. They're not necessarily going to be on crutches forever. It's a crutch that they need at that point in time to help them walk, to get to rehab. And that's what medication can do too. I think a lot of parents are so scared because they're concerned about addiction, they're concerned about the stigma.
Right.
But nothing has to be forever. But if there is a child or an adult who's been on medication for a long time, the body does get used to it. And tapering medication needs a lot of support, supplements, exercise, and group support. So tapering off meds is difficult. And so I always say, these are the risks and benefits. Everybody has to have completely informed consent. And when I mean informed consent, I mean, if SSRIs increase your serotonin by blocking the serotonin receptors, exercise does the exact same thing. And that's informed consent.
Right. I've seen studies that say a certain amount of exercise every day is equivalent for depression to SSRIs. That's amazing.
Right. But that's real informed consent.
Right.
Because
right.
one has side effects and one doesn't. Of course, if side effects in terms of if you have a cardiac risk, there's a side effect. If you have a knee problem, but the true informed consent means that you offer alternatives to the medication.
Right. It also may be that the person can't get out of the house because they're too depressed to walk, and it's a vicious cycle until you medicate them. But once you medicate them, you can train them in, like I said, pills and skills so that they can wean off the medication and use exercise and diet, et cetera.
Exactly. Now, the reason that, and I don't judge, that's the point. I don't judge. I can say exercising a half an hour on a treadmill a day will do the exact same thing as taking this pill. I don't want to exercise. I want to take the pill. Okay.
That's fine.
So, but explaining that is very important because people think that they need meds.
Right.
And there's nothing else they can do. And that's
very disempowering.
Not true.
Especially when the medication's not working or there's too many side effects.
Right. And people they say, this is the medication and it's going to help me. I mean, the belief is already the placebo effect, which is great. So it really is about the most important thing in healing is the therapeutic alliance and the trust. Because when a person has the belief that something will help them, it will help them.
It's so interesting that you say that because we had this conversation in my family and I was talking to two members, one who understood both perspectives of, mainstream and alternative and how they could work. And the other one was like, no, just give me my antibiotic or whatever it is. And she's like, but it works in part because you believe it works. And the other person is using something else and their belief that it works. Right. Again, I don't want to oversimplify here, but when you mention the placebo effect, I mean, that's a whole separate conversation, really.
Let's say somebody is referred to me, okay? And they heard about me from whatever, it's online or a friend. Before they even see me, their symptoms will start improving. Because they have the trust that they know someone's there and is going to help them. And that's already such a relief. And so that's, as human beings, really what we need is the holding environment.
Right.
Which is like the womb-like, cuddly, soft, warm holding environment. And if many of us didn't get that for long enough, that holding environment that the therapeutic relationship brings is so healing on its own. Just the energy that it almost doesn't matter what happens because the person knows they're safe, the safety, the belief in safety. And I have a lot of people that have been tornado through the fragmented system. And they're getting so much better because they're like, oh my gosh, you actually listen. You're not just saying, take this, go and go. Because I have adult patients too that have different practitioners and providers and medications and comorbid conditions. And just knowing that I'm not going to see them for 2 minutes, turf them. It's just
Right.
like so healing.
Right. The fact that you care as a
Yes.
person. I mean, I just went through this personally, and I wouldn't go back to this particular place because exactly that. I was treated like, a body part, not
Exactly.
a human being.
When a person's treated like a body part,
Right.
there will be more disease because it's not humane, and that energy is absorbed, and that absorbed energy makes people feel sick. And when I see it in kids all the time, when they're in an environment where people don't care about them, whether it's home or school, they don't care about themselves because they're internalizing those energies. So to be in an environment where you're going to be held, and that there's real holistic understanding of you as a human being. I also don't like to have any kind of hierarchical patriarchal systems. Like, I don't know more than you. I always tell people.
That's interesting. And talk more about that.
Yeah. So I always say to patients, I don't know your body more than you know
Right.
your body.
This is what I say to parents about their kids. You're with your kid 24/7. I'm here for 10 minutes. Unfortunately.
You live in your body. You
Right.
know your body more than anybody else. And if something I say doesn't resonate with you, there's the difference between resonance and resistance. Okay. So things have to resonate with a person. A resonance is like that gut feeling. Yes, that's right. It makes so much sense. Resistance is, I know it's right, but like, I don't want to do it because I'm so used to smoking, and I know it's right, but I'm just like resistant. There's a difference.
It resonates, but you're resisting.
Exactly. So when I counsel somebody, I don't try not to be didactic with my approach or patriarchal, because it never works.
Right.
I don't need someone to be compliant to me.
Right.
I'm not the dictator of what you do with your life.
And you want them to be able to come back and say, hey, this didn't work, or this doesn't, like you said, resonate with me. I don't think this is right for me. I know I want that as a pediatrician too. I want the parent to say, my gut's saying something else,
The idea of compliance speaks to a patriarchal system, does not resonate.
Right.
I am not in charge of you.
I mean, truthfully, this is the way medicine is going, should be going everywhere. And the newer doctors are being trained like this.
Yes. It's like, you don't have to be compliant to me because I am not responsible for you. You are. And so
but also for, right, I mean, but also for you to be able to say, you're telling me that I have to exercise, a half hour a day, but I know that will never work for me. Let's come up with something else. If the patient doesn't feel empowered enough to stand up and say, you told me to do X, but I'm not going to. Yeah. Or there's more than one kind of test, and one test is less invasive, for them to say, I need to do the less invasive one, or I need to do the more invasive one, right, because it's going to take less of my time, energy, and travel. Do you know what I'm saying?
Right. The thing is this, on a cognitive level, I don't measure cognition, like from a hierarchical standpoint. Western traditionally trained doctors might know more, but to me that's meaningless. Knowledge doesn't matter. What's important in healing is insight and intuition. On a cognitive tier, we have Google. I mean, we don't need more knowledge, right? When it comes to healers, what we need is a higher level of consciousness and a higher level of intuition. And that's what I bring people up to be more aware of what they're doing, their patterns, their habits, so that they can change it, because only if they're aware of them can they change. So that's why I don't like this idea of I'm the decider and you need to be compliant to me, because I am not that. I call people healies. And I don't call myself a healer. I'm not even a healer. I'm just there to speak.
A co-healer.
Exactly. I'm there to speak to what your soul wants. And if your soul wants to go in that direction, then I'm here to clarify that and guide you and support you in that direction.
I do have to tell you, though, that there are still people that want that good old fashioned Marcus Welby. I'm just saying, somebody wrote a book about this, and they said there are still people that want to be told, take this pill at this amount of hours apart. It's just, some people do that. I'm just saying, there's
I mean,
different types of
for sure. I mean, if I give
approaches.
of course, if I give instructions about a medication, I'm actually like, oh, do whatever you want. No, of course I'm going to guide the person as to
Right.
how much to take and when to take. But I'm referring to behavioral change.
Right.
What
I'm just stopping for just a minute and saying, like different people have different approaches. I also, practice actually similar to you, although I don't practice psychiatry, I practice pediatrics. But I really do like to collaborate with the parents and really listen to them and work with them. And some parents really actually prefer the more old-fashioned, more patriarchal. I'm just saying.
Of course, because if you don't feel empowered about your body and you're not connected to your intuition, of course you're going to want to defer and outsource it.
Right. It just may be also cultural or just the way you're used to it. And
but our culture does not focus on our intuition.
No, it doesn't.
And that's why, but if everyone has intuition, whether they trust it or the extent to which they trust it, that determines the level of empowerment. My goal is, for when I work with people, is to connect them to their intuition and trust it. And our culture, it's countercultural.
It's countercultural. And some people can be like, just give me the drug. Think about like giving birth, right? There'd be some people that want a birth plan and they want to try birthing out a ball and in a water. And there are others like, I want that epidural the minute I have my first contraction. So
right, because we live in a healthcare system that is distress intolerant. Distress is negative and it needs to be repressed and it needs not to be experienced.
Which is unfortunate because life is full of distress.
Of course. You cannot be resilient.
Right.
And distress intolerant.
Right. It's one or the other. It's one or the other.
If you want resilience to be able to overcome life challenges, you need to know that not to freak out with pain, not to freak out with discomfort. It is part of our human experience. And we have been conditioned to negate, repress, ignore, hide all of those experiences. There's nothing wrong with pain. There's nothing wrong with sadness. There's nothing wrong with discomfort.
And it's also the long, short road and the short, long road kind of thing.
Road. I mean, my personal
no, what I'm saying is that there are some people who come to the doctor and, I may say to them, okay, I think you have a mild sinus infection. And really, if you do plenty of saline and fluids, you will get better. Maybe you could do a nasal spray, whatever. And some of them will say to me, no, I just want my antibiotics right now. And you might, feel better more quickly with the antibiotic. It's true. But your body, 80% studies have shown of sinus infections, even bacteria once heal without antibiotics. It will just take a little longer.
So why? So let's talk about that. Why are people so quick to fix? And I'll tell you why. We have been conditioned as industrialized machines, and the focus is productivity. People have this misconception that the goal of this world is to be productive, to produce. That's not the goal of our human experience. The goal of our human experience is to master our shadow, to be an integrated human being and experience all parts of us, and to be able to transmute negativity and bring in more, meaning to be light beings, to be our most authentic selves. Resulting from that will be productivity, will be emanations of your highest joy, your highest passions. But because we have been conditioned to focus on the material productivity at the expense of everything else, it's always a rush.
Right.
Because if you're on the conveyor belt and you're in a factory and you're having to work then you can't attend to the other things that are the important things of being on this planet.
Right. To be practical and fair, though, for someone has to get to work the next day.
Yes, but it's not that. It's a mindset, because people can go to work every day and still do saline 3 times a day. But there's just a conditioning of quick fix.
Right. It's a quick fix society.
Exactly. And the quick fix society is conditioned because of the conditioning of distress intolerance, because distress does not have to be so bad. It's just that people are afraid of it. And it's the fear that makes it bad.
It's interesting that you say that. We're not going to go down this rabbit hole, but for people who struggle with chronic pain, there's the whole, say, Sarno method, this mind over matter. I mean, it's very oversimplified, But I think, and somebody who really knows this may correct me, that it involves learning to tolerate the pain, interpreting the pain in a different way to tolerate it better, instead of being able to make it go away, because you can't always make it go. And we all know that,
Right.
Being chronically dependent on pain medication is a problem in and of itself.
Right. And that's why I don't judge. And I
Right.
always say, I am not in your body. I do not have your experience. And this is what I offer as a tool. And I don't judge. And that's right. And that's why. Because there's certain, I believe that there are certain somatic experiences and discomforts that is for our ascension. All of it is for our ascension. And I also believe suffering is purely perceptual. It's not physical. It's the way we perceive things that makes us suffer, not the actual experience. But people are limited, and people also don't want to do the work, and they just want to be comfortable. And that's fine. Anybody and everybody can choose how they want to live, the way they want to live. I am not going to dictate that for them.
Right. And I think it's also important for people who are in pain to have that locus of control.
Absolutely. And also, I'm not villainizing anything. I don't villainize medications. I don't villainize Western medicine. I just think that everybody needs to be given choice in all the tools out there. And there are people that villainize it. And I think that if you follow the path of your highest calling, things that are not naturally good for you, you won't be attracted to. Things that are in alignment with where you want to go, you will do, and things that aren't, you won't want. So what I'm trying to say is people know what's best for them. And I really do believe that. And people can also people have free will to choose what kind of experience they want. I would never tell somebody, deny them pain meds.
Right.
If they want to get off, okay, like let's do other stuff. But I'm not interested in having you be uncomfortable. If you say I don't want this, that's something else.
Right. And that's amazing. That's really, really amazing. I want to segue to a different topic, sort of, which is one thing I'm paying a lot of attention to is how much our teens are suffering lately with their mental health. And so I'm really curious what your take on this is, and maybe what some of your ideas, because you have this incredible background, right? You have a holistic approach. You're trained as a child and adolescent psychiatrist and in public health. So I want to hear your ideas. What do you think? What could we do?
Okay. So first of all, get rid of the phones.
Good luck with that one.
Here we go. Parents are succumbing to parental peer pressure. This is not teen pressure. This is parental peer pressure. And enabling their children to want to be like other children who have devices because their parents are enabling. Stop it. Just stop it. Stay strong, parents.
Right. It's the later you give it, it's kind of like alcohol, the later the child's exposed to it.
Kids do not need an iPhone, period. Nothing, period. They don't need it. If you want this, I have parents who say, but I need to communicate with my child. Buy a flip phone, buy a little hand thing. Nobody needs a mini computer with millions of apps. It's totally unnecessary. It's not necessary because, in my opinion, the risks far outweigh the benefits.
Now, it's huge risk, but I'm telling you, until we create a groundswell from the kids themselves, this is going to be a losing battle.
But that's what I'm saying.
It's a losing battle.
But what I'm saying is,
we
need to be empowered parents. Who's paying the kids' phone bills? It's not the kids. And you just have to stand strong and resist. That's what parenting is. Parenting is not being a pushover. Parenting is not going according to trends when you know it's not good for your kids. The data is indisputable. Higher distraction, poor sleep, higher anxiety, more addictive behaviors. It is not worth it, parents. If you need to be empowered, talk to me. I have no problem being yelled at by my kids. And the truth is, my kids are happy that they're not addicted. They see their peers on their phones all the time.
How old are your kids?
I have an 11 and a 13-year-old.
Mhm.
They're exposed enough to screens. My child doesn't have writing utensils, doesn't have notebooks. He's in a Chromebook all day given by the school. There's no reason for him to have a mobile device, nor is there a reason for him to have an iPad. Mobile devices are the most dangerous because then kids feel like they own it and that it's theirs. Want to give kids screen time? Put it on a TV. It's because the idea of mobile devices gives kids ownership, and children are not biologically equipped to control the dopamine surges that screens give.
And I just had a patient that just told me, he says, I knew I shouldn't have one. And I tried to hold off as long as I could. This is not a Jewish kid.
They can't control themselves. They're not biologically wired. Their impulse control centers are way too dysregulated.
But the older the kid gets, the more weird it gets when you don't. I mean, it's easy to tell the parents that they should, not be pushovers, but it's one thing when you're talking about middle school and certainly younger than middle school. When you're talking about high school, that's a whole other.
Okay. So I'm talking about before. How old is a child when they start high school usually?
14.
Okay.
15.
So 14, 15, no. There's no reason. If schools start requiring things that need apps, that's a different story. But I see 2-year-olds.
Right. So I think that is a huge problem. We're actually going to be hopefully doing a webinar on digital wellness, safety, citizenship. And I was speaking to the founder, was Dr. Eli Shapiro, and he says, go look in a pediatric office and you'll see it used to be that the parents would soothe the child and now they just hand them the phone.
Right.
Toddlers, babies.
Yeah. So
lack of resilience and lack of, ability to tolerate any distress. There's no need to tolerate distress. Just give them a phone.
It's escapism.
Right
there. Just escapism. And parents are becoming intolerant to actually parenting because they're not able to handle dysregulated behavior. That is what we need. Children are naturally dysregulated. They come out of the womb crying. They need to be soothed. They need to be fed. That's what the role of parenting is, to regulate dysregulated behavior. If you don't have signs of dysregulation, you lose that whole power system. You lose the entire power system that we have as humans. And it's extremely detrimental. And it's I call it technological hypnosis. When a community or the masses are so hypnotized by media, things can seep through, negative, like a lot of things. It's almost like a giant that gets distracted, and then all these things, you get so, you wake up in the morning and you want to check one thing, and then you just get sucked in and do everything else, and then you miss out. You could have done an hour of running and you didn't get that done. I mean, it happens to everybody. But we lose boundaries, we lose ability to connect to our intuition, actually.
Right.
That's what it ruins. And it also, on an energetic level, the rays, there's a lot of radiation coming out of the phone. So you should buy an EMF protector to put on the back, or you should wear a wristband. It's an EMF protector wristband. It's a radio signal, and it's the radiation is not benign. And so to connect to our intuition, we actually have to have no interference. So it actually makes it much harder for people to focus inward in terms of what they really want, because they're so swayed by this ad and this email and this. It makes it really difficult for a person to focus on themselves.
Right. It's ADD-ogenic.
Yeah,
it's very problematic. But I will say, having tried to work through this myself with my own kids, it's really hard. I mean, just like you don't want to judge about people who choose medication over a non-medication approach, tolerating pain versus taking pain medication, different people in different situations. It's really, really hard, and it gets harder when they get older. So I'm really hoping that we can have more programs that empower the kids and teach the kids directly rather than put it all in the hands of the parents to, I used to think of the screen problem as stepping on roaches. You step on one screen, there's another screen there, you're constantly in battle position as a parent. And it's talk about energy, it's very anxiety provoking.
Right. So it's all
for
about
parents. I'm very empathic for that.
It's all about balance. There's always a balance, especially diet. Like we're not going to like restrict sugar, but we're going to limit sugar. We're not going to,
Right.
So it's all about balance in terms of my approach to medication, pain, and internet. If you want to teach pre-skills before a child would get any device, pre-skills I teach are, if a child is on any device, it should be timed and not something that you stop. It's something that the computer stops and the computer shuts off automatically, because then aggression is aimed at the parent.
Right.
So it should be pre-timed across the board. It should not be just unlimited usage. That's in terms of actual time. In terms of content, it's very hard to control content. Okay. But what I do with content is I ask my kids what they're watching on YouTube, or I observe, and I talk openly about pornography. I talk openly about aggression, about violence, and I talk about it. And I say, this is why it's bad. Or I don't necessarily believe I mean, for certain ages and certain types, like in that age group, I explain and I say, if you come across this, let me know. Because I've had patients whose parents found out their kids were watching porn for 3 months and never told the parents, never discussed it with the parents. And that's when you get repressive, high-risk behaviors, when the parents are not open to discussing content.
Right. So having that open line of communication with your kids, that's always the rule. That's always good.
Restricting content could only go so far.
Right.
Because there's always exposure to, because everybody has a phone, their friends have phones. So I'm not a fan of restriction. Of course, children should know your expectations, but I do always believe that there's going to be exposure to things that are not appropriate for their age at some point in the game. And to be there as an askable parent is so important. And so
there's nothing that you can't ask me. I won't get mad at you.
Right. And also that will decrease risky behavior because they don't feel like they have to hide. So so timer always with anything in terms of, balance, and openly discussing any type of content. It also alleviates any trauma, because if a child sees something that's aggressive or inappropriate, if they're discussing it and processing it with you, they won't feel traumatized. They won't have bad dreams. It won't be stuck where like, oh, this is unresolved.
Right. And it'll also be something that they can ask you about so they don't have to go to the internet to find out.
Right. But a lot of times these things happen by chance or by mistake or through a friend.
Right.
And I feel very proud that I feel like my children feel comfortable asking me about something that they're like, yeah, this guy in class, he showed me this site. And it was like, I was like, oh, okay, that's interesting. Let's look it up together. We looked it up together. It was, and we talked about it. So that's the kind of relationship that's important to foster.
Right. You didn't shut down that conversation. You talked about it. That's amazing.
Regarding content. And in terms of sleep, so if a child, again, I think mobile devices is difficult, but if a child, there's needs to be a turning in the device time. So before bed, like it affects sleep so much, and there needs to be a cutoff.
Right.
At which point they don't use past a certain time. And the parents really also have to honor that for themselves. You can't be on your phone and taking the phone away from the kid. So I think parents also have to follow their own advice.
That's really, really good advice. One more thing I want to talk about.
Yeah.
And that's, I did a podcast with Dr. Miriam Gamliel on out-of-the-box thinking. I don't know if you got a chance to listen to it yet.
I didn't, but I will.
Oh, I just wanted to know, because you are my classic divergent thinker. So I just wanted your thoughts on how to foster our kids who are divergent or out-of-the-box thinkers.
I think that the box is overrated. I don't want to comment on the divergent thinkers. I want to comment on the box.
Okay. Who created this box? Who made that one?
Yeah. The box is extremely archaic and very, very out of date. Okay. This box came in the industrialized revolution. We really needed people to sit and learn and then become workers in our economy. This is not useful today. People have become YouTube stars. People are starting their own businesses. The world is at our fingertips with the internet. There's boxes breaking. Good. And that's good. So it's not the thinkers who need to be fostered. It's the box that needs to break. And I think that we're starting more and more to see how our educational systems and our healthcare systems and our political systems are just cracking because they're not meeting the needs of our creative masses.
Right.
And it's not about everybody's creative. It's not about more creativity versus less. Yes, everyone comes here with different skill sets, but in the end of the day, we're all creative people. We all have a reason we're here to do something, to create something. And even if it's with working in a team. So the problem is not the way we think. That's the asset. The problem is the way society has been running. And that's really not fitting us anymore.
Right. So one of the things Dr. Gamaliel said is that we need to nurture our out of the box or whatever divergent thinkers, because they're the ones who are going to solve our problems, right? They're the ones who can think beyond the box.
So I want to disagree with that. Everybody can think beyond the box. We are not trained to think out of the box. We are not trained in our current archaic educational systems.
It's so interesting you say that because I'm thinking of, how children when they're young, make these beautiful, all kinds of original artwork. And as they get older, it becomes very rigid in this classic stick model and the little house and the sun and the grass. So you're right. I mean, we are training away that kind of.
Absolutely. We are training away intuitive thinking.
Right.
We are training our children out of their intuition into our cognition. And that needs to shift because computers are taking over our cognitive capabilities. And in the strength and power of the human species is in our intuition.
Right.
And so we have to focus on training children intuitively. Children are much more conscious than adults. They're much more conscious than adults because they're not conditioned in any sort of way. So they follow their intuition. Wherever they are, they follow their intuition. They throw food. They don't like the food, they throw it. It's very clear. Like they're the most intuitive people. What we have been doing is we just destroy it with.
We squish them into the box.
Yes, and we train them cognitively like a machine. But what we have to start doing, and that's also why I'm starting a new educational infrastructure that really puts intuitive training into cognitive training so they can be really integrated, is that we have to keep the kids in their purest intuitive state and then continually foster that intuitive thought process with critical thinking in all areas of academia.
That is amazing. I'm going to let you tell us where we can find you, including about the Teal Dragon, which I didn't introduce in the beginning because you're alluding to that now. One of the many hats that you wear. This has been so amazing and so interesting, I think, and so many interesting ideas that I'm hoping people will find helpful. So where can we find you?
Sure. Thank you so much. So I have a website. It's called tealdragon.org, TEAL, dragon, DRAGON.org. And that's some information about my practice. I call it the Teal Dragon Healing Practice. Like I said, I'm a licensed psychiatrist, but I call my practice healing because that's what I feel I do. And then we are also having educational programming that combines therapeutic aspects and healing aspects to actually help children connect to their intuition and socialize and integrate more, because there has been so much trauma that families have had to go through.
Right.
And we really want to bring life and joy back to families, and kind of help them clear and purify all the negativity that has been going on in the world. And it's just, people are really coming out of the woodwork and coming into these spaces, and they just need so much support. And that's why we're there. And we have a really large network, and we have wonderful teachers and educators that are all on the same page in terms of how we need to really change the infrastructure, focus on joy, focus on love, focus on what human beings really want, and get out of this hyper intellectualized space that we've been in. So
Get out of the box.
yeah.
All right. Thank you so much for doing this with me.
Yeah, my pleasure. It's been wonderful. Thank you so much.
Yes. Be well and have a good Shabbos.
Okay, thanks.